Okay, here is part 4 for the stuff on treatment. Moving forward, a few more components of cognitive therapy. Cognitive restructuring. This is the process of helping clients in therapy view their situation in a new light or a new perspective. That then allows them to shift their thinking from the focus on automatic, distorted, negative thoughts to more realistic ones. So you're basically getting someone to think differently about something or some things. The best example I could come up with is kind of thinking the body types, these ideal body types that the media puts out for us, for all of us, are very unrealistic. A lot of young men and women think that they have to look like the Barbie doll or the cut warrior, if you will. And if they don't, then they're not a success in life. It's not realistic to think that we can look this way. So you have to get people to kind of think differently. If you're aspiring to an unrealistic body image, it's going to create potentially a lot of problems. Psychoeducation is another component of cognitive therapy. This is something that I've done a lot with my other job, working as a psychologist. This is the process of educating clients about therapy and research findings pertaining to their disorders or problems. So here you're actively engaging the client and educating the client about therapy, about research, about things that happen in the physical and the social environment. And it could be this could be a very effective tool as well for a therapist. I'm not going to inundate you with all the different types of medications, but psychopharmacology is another type of treatment. So we're moving away from, the behavior-based, the cognitive-based therapies, and we're moving in the unconscious stuff and moving more into just medications. Psychiatrists are trained medical doctors. They are trained to deal with these issues in a way that they can prescribe medications to deal with mental health problems. And we've talked about that in class. The fact that for sometimes people with depression, they have lower levels of certain neurotransmitters in their brains. Maybe they have lower levels of serotonin than someone without depression or someone who does not have depression. So some of these medications are designed to combat or to sort of bring up to a homeostasis or an even level, word I'm looking for there, certain neurotransmitters in the brain or chemicals in the brain. So pharmacology. This is, you want to jot this down, the use of medications to treat psychological disorders and problems. And again, your book chronicles several different types of medication treatments, rather certain types of medications, psychotropic medications like the antipsychotics, the SSRIs, those are the selective serotonin reuptake inhibitors like Prozac and Paxil. I'm not going to hold you accountable for those. But you can look through those as you see those. I did think this was interesting. The 10 most prescribed psychiatric drugs in the U.S., and I pulled this from a different site. These are pretty current statistics. You can kind of see Prozac is one that people hear about a lot, and they've heard of that. 19,499,000 prescriptions for Prozac. That's a lot. It appears to be one of the most heavily prescribed drugs. You can see the most heavily, the most heavily prescribed drug appears to be Xanax, 44 million prescriptions. You've got 27 million for Lexapro, 25 million approximately for Ativan. So it's a booming business, and a lot of drugs are prescribed to help combat mental health problems in conjunction with therapies that are occurring as well. A lot of times someone who's in therapy, whether it's behavior therapy, cognitive behavioral therapy, psychodynamic therapy, whatever, may also be on psychotropic medications. It's not uncommon to have both at the same time. Now, individual therapy. There are different ways we can go about it. The traditional sort of way that most people think about therapy is the one therapist and the one client sitting in the office, the person sitting on a couch talking to the therapist about his or her problems. But also there's group therapy. and I've actually run some groups before in the past. Group therapy involves a therapist and multiple people. Maybe you're running a group for depression. You may have 10 people who have depression, and one trained group therapy leader, psychologist, who is kind of taking the lead. People can talk about their problems, and they can see that they're not the only ones with the problem at hand, and that can help. If you know there are 9 other people in the room that have the same struggles and issues that you do, it might actually help the healing process. It may actually help you feel and function better in the capacity of your disorder, whatever that disorder may be. One of the big issues, though, with group therapy is confidentiality. Confidentiality simply means that you don't talk about whatever happens in group. As a therapist, as a psychologist, I am bound by confidentiality. I can't run out of my office and tell my wife or my friends or people I don't know, hey, yeah, I just saw Joe Schmo in therapy, and you're not going to believe what he said. He said, but can't do that. It's unethical. It's not appropriate. I could lose my license for doing that. And the big thing with group therapies is that everyone in this therapy situation has to sign an agreement that they will not discuss the issues outside of the group that are discussed, because a lot of people would be afraid to go to a group therapy session because, well, 10 other people know what I'm talking about. Who's to say they won't run out and spill the beans and tell everybody about my problems? That is one of the issues with group therapy. As effective as they can be, or as effective as it can also create those confidentiality leaks, if you will. Family therapy is another type of therapy. I've never done family therapy, but sometimes you have a trained therapist with family members. You may have a mother, a father, and a child all together, trying to work on their problems together. Family therapy is a therapy modality where the family, or even certain members of the family, are treated. And family therapy can be pretty effective. Systems therapy. This is a type of therapy where the client symptoms are viewed as occurring in a larger context, where a system, thus the word systems, and change in one part of the system affects the rest of the system. And there are different types of systems therapies, but it recognizes that you have all these different areas of life, and they all, if you can affect, if you can affect one area of the family, then that will affect the rest of the family, and hopefully in a positive way. Self-help groups. Self-help groups, by definition, we're talking about a group where members focus on a specific problem or disorder, and this group does not usually have a trained leader. That's why it's often called a support group. Alcoholics Anonymous is a classic example of this. There's rarely ever a trained professional. People just kind of get together and they talk and they support each other. And you don't have to have a trained mental health professional there to run a self-help group. They can be very effective. Sometimes, and I'm not going to lie, and I'm not offended by this, but sometimes clients will say to me, you know what, Brandon, you've never been an alcoholic, and I never have been. So they say to me, talking to you isn't going to help because you don't understand where I'm at. You don't understand where I'm coming from. I'd rather go talk to a sponsor or someone who's been through this. And that makes sense to me. I can understand and appreciate and respect that. So sometimes self-help groups can be just as effective, if not more effective, than traditional therapy sessions where you have a trained mental health professional. Bibliotherapy. This is another type of self-help where you use books and audio and video information for therapeutic purposes. Books and tapes, for example, videos, to kind of help. And this can be very effective for people who really want to learn about their disorder. They may read about it. They may purchase videos. Dr. Phil is famous for his books and his tapes and his videos on self-help kind of stuff. So that can, and you don't really have a trained leader or therapist in the room sitting there talking to you, but it can still be effective, for sure. Outcome studies are interesting to talk about. So what's better? Is therapy better than medication? Are medications better than therapy? Is no therapy at all just as effective as therapy? Outcome research, by definition, you'll want to jot this down. This is research that addresses whether after let me back that up. This is research that addresses whether after therapy clients feel better, They feel and they function better, live more independently, or experience fewer symptoms. And really, the research is all over the place. It would take a long time to talk about that. For some disorders specifically, we see that therapy may be more effective than no therapy at all. For depression, for example, we know that if left untreated, a single episode of clinical depression may last anywhere from 6 to 9 months. With treatment, that's medication and or therapy, a single episode of depression will not last that long. It could cut that episode in half. So in that case, we see, generally speaking, that treatment is better than no treatment. However, for some other disorders and for some other problems in specific contexts, we see that sometimes no treatment is just as good or effective as, let me back that up, that no treatment is just as good or effective as treatment, as therapy or medications. So it just kind of depends. And the research is all over the place. I'm going to direct your attention to your textbook where it talks about, it starts on page 465 and extends into 467, I believe. So you can kind of read up on that. And that's pretty much the end of part 4. And that's the end of the stuff on treatment. Thank you.